Hi there, I'm Dr. Molly with Birmingham Pediatrics and Campground Pediatrics, and I wanted to just give everybody an update about coronavirus. We call it COVID-19 here at the office, and I'm sure most of you, if not all of you, have heard quite a bit about the coronavirus. As you all know, it's in the United States now. It's not in Michigan yet, but it's certainly going to be, and probably pretty soon. So I wanted to take a few minutes and just give you some information that'll be useful for your families as you get prepared and we get prepared for what is probably the inevitable appearance of COVID-19 in our area. Coronavirus is a virus variation that we've actually seen the base virus for a long time. Children get coronavirus infections all the time. They're really just a common cold. What's different is that this version of coronavirus is new and it's pretty significant. It causes significant flu-like symptoms, meaning high fever, body aches, cough, runny nose, and for fragile individuals, especially older people, lower respiratory tract infections like pneumonias and shortness of breath. Children, though, don't seem to be very vulnerable to the coronavirus, and reasons for that really aren't clear yet completely, but one of the possibilities is that because children so often see the other variations of coronavirus, they may have some native immunity to the virus and therefore may get mild symptoms that don't look very different from other colds that we see every day in children. Adults, however, because we're older and don't get sick as often, this is a much bigger deal for us. What you can do to prepare your family for the coronavirus that's heading our way is not panic. I think that's super important. There's so much information out there and media excitement over this that it is natural to be concerned. But I don't think panic is needed. We have an advantage here in the United States to be not on the leading edge of this infectious disease, but rather getting to learn about how the infection moves and changes, how it infects people, and how it changes as it's moving. So we've been able to prepare. And as a result, we can be ready for it differently. I do think it's important to practice hand washing, to practice coughing into your sleeve, and to make sure that if you are sick at all, that you're not going to be around fragile people, mostly older people, or people who have underlying issues in their immune systems or have lung issues. I think those are all going to be important things. Once coronavirus gets to our area, or if you're traveling to areas where it's really widespread, and right now those are all areas out of the country, I do think that once it gets in our area, guidelines are going to change, and we are ready here at Birmingham and Campground Pediatrics to help you. We have telemedicine already, a part of our practice. We'll be able to help by looking at you and your children in the comfort of your own home. We can help guide and assess whether or not your kids are going to need to be seen. I want to encourage you to be contacting us. We can help guide the care you're going to need as the illness comes into our community. Going to urgent cares, going to emergency departments, reaching out in other ways may actually increase your risk of infection rather than diminishing it. So call us. The incubation period is long. It looks like it's 2 weeks or more. And so from exposure to infection, there's a big gap of time. And then once symptoms begin, which look like regular cold symptoms, most people are going to recover. Actually, 97% of people are going to recover just fine, maybe more, because I think we're not even picking up most of the mild or asymptomatic cases. So I think that the actual rate of severe infection is going to reduce as we learn more about this virus. I know there are a lot of concerns. Don't stock up on masks. You don't need them in your basic home. And if you have travel plans at this point, if they're within the United States, I don't think you need to even consider canceling them. We're going to be giving you updates regularly. We are available to you. Please give us a call and know that we are ready. We've got phases in place in our office. We have telemedicine appointments, and we are your partners in care. Again, I'm Dr. Molly with Birmingham Pediatrics and Campground Pediatrics. Thanks.